Hey there, Christophe from the French Herbal. If you care about your memory, your cognitive abilities, and your overall brain health, you will like the plant we are going to talk about in this episode. We have used this plant in the East for a very long time, in the West for a much shorter time, but at this stage, between the clinical studies and the practical experience of the herbalist community, we have a high level of trust in the properties of this plant. Its Ayurvedic name is Brahmi, Bacopa Monnieri, and we are going to take a deep dive into what that herb can do. But before we start, a quick but important reminder: I'm not a doctor, a pharmacist, or a licensed healthcare professional. The information shared in this episode is for educational purposes only, so not intended to diagnose, treat, or cure any condition, and it does not replace medical advice. Okay, so Bacopa is a perennial plant that belongs to the Plantaginaceae family. It used to be in the Scrofulariaceae family, but it's been moved in the 2000s, I think. You may still find old books that classify Bacopa in the old family, so don't be surprised. It used to be a cousin of figwort, and now it's a cousin of plantain. It is a creeping, succulent plant native to India. It grows with its roots in water, sometimes completely submerged. You can even use it as an aquarium plant. Otherwise, you can keep it in a big pot, in a container of water. That will work too. Be careful not to confuse it with the ornamental Bacopas used in gardens or on balconies. I once ordered Bacopa Monnieri from a grower here in France, and I was sent Bacopa cordata instead, which is an ornamental species that is not medicinal at all. So watch out for mix-ups. If you order your medicinal plants, make sure you order from trusted sources. And if you're not sure, ask them to double check that it's indeed Bacopa Monnieri. So I keep the plant in partial shade because it gets very hot in my garden in the south of France in the summer. I give it a pretty rich soil. And this is a plant you would put on the edge of a pond, for instance. It's super easy to grow as long as you give it warmth and lots of water. And as I said, you can also grow it as an aquarium plant. It does not tolerate cold well, so it needs to be protected during the winter, or you need to bring it indoors. And I once forgot to do that, and I lost all of my Bacopas outside. You can propagate the plant super easily by pulling one of the stems from the soil along with the tiny white rootlets, and you just put it in another pot, or you just take a cutting, replant it in moist pot, and just wait until it makes new roots. That's it. Quite easy. And one last warning, there is another plant that is sometimes called Brahmi in Ayurvedic medicine, Centella asiatica, which is a completely different medicinal plant. And that's the problem with common names. It's best to use the Latin name. And that other plant, Centella, is also called Gochucola or Manducaparni. So, back to Bacopa. The parts we use in herbalism are all the aerial parts, the leaves, the stems, and the flowers. And as I said, the plant is a succulent, so it's very fleshy and juicy. And just looking at it, you may think that it's all, mucilage and sweetness. Well, it is very moist in taste, to be sure, but it's also surprisingly strong in taste. You can trim it regularly to make your preparations, and it will grow back very vigorously. And we'll talk about preparations a little later. You can, of course, purchase the dried herb from providers, but be very careful about your source, because this plant grows in water, sometimes near sewage outlets in India, and it can absorb all kinds of chemicals. And some studies indicate that Bacopa harvested in India may contain high levels of heavy metals. Of course, I'm not saying that all Indian Bacopa is polluted. I'm just saying that some studies done on imported Indian Bacopa found heavy metals. Therefore, buy from trusted suppliers with good traceability, solid quality control, and manufacturing practices. In terms of constituents, Bacopa is very rich in different chemical families, and they all bring interesting properties. First, we have triterpenoid saponins. These compounds can be found throughout the plant, in the leaves, in the stems as well. And those saponins include several bacosides and bacopasides, and they're all quite potent, and they are present at a concentration of up to 6% of the dried weight of the plant, which is quite high. We have flavonoids like apigenin and luteolin, responsible for its antioxidant and anti-inflammatory properties. We have alkaloids. The primary one is Brahmin, which is believed to contribute to its neuroprotective effects. Brahmin was one of the first alkaloids to be isolated from the plant. We also have herpestin, another alkaloid notable for its properties. We have other triterpenes like betulinic acid, betulic acid, wogonin, and cucurbitacins, which are responsible for the bitter taste of Bacopa. So with this richness and complexity of constituents, one of the key challenges is to know what type of extraction will bring the best result. And this has been a little frustrating for the researchers. If you look at studies, you see that the various types of extracts differ in composition and concentration, which further complicates the reproducibility of the results from those research, right? And so results inconsistent from one study to another, a little frustrating, but that's the way it is. We'll come back to what are the efficacious forms for Bacopa, what transformation to make, and the quantities as well in a few minutes. The energetics, cooling, and slightly moistening. Okay, let's talk about the properties and indications. In Ayurvedic medicine, it's used for many conditions like water retention, bronchitis, joint pain, etc. So I'm not an Ayurvedic practitioner, so I cannot really tell you about those properties. I never tested them myself. I have used Bacopa for what came out of the most recent studies. So Bacopa is particularly renowned for its impact on the nervous system. More specifically, the plant's main specialty is to improve our mental abilities, also known as cognitive functions. And when we talk about cognitive abilities, we mean a set of functions including concentration, memory, reasoning, learning, and decision making. And these are the functions that allow us to solve everyday problems and complex situations. So they're very important to function well in society. And sometimes, especially under chronic stress, they become deficient. We then talk about mental fatigue, mental fog. Well, Bacopa helps improve these abilities in a global way. And we call this property nootropic. And it works in both young and older individuals. We have several clinical studies that show Bacopa can improve brain function in relatively young and healthy subjects. In one study, we see maximum benefits after 90 days of use. So you have to do it for a little while, right? And in older individuals, taking Bacopa improves memory and the ability to ignore irrelevant information when performing a task. In other words, Bacopa helps us to retain relevant information and to discard what is not relevant. Quite interesting, right? A quick pause to let you know that you can grab my free ebook on preparing herbal teas for the 4 seasons. It's full of simple recipes and blends you can make with herbs you can buy or even grow almost anywhere. The link is right below this episode. I hope you enjoy it. So it is a great generic overall mind tonic, and it can help someone prepare for exams. Ideally, it should be taken for 2 to 3 months before the final exams and during the period of when you're studying, right? And I like to combine it with other plants and supplements, plants like rhodiola, although in Europe we have issues with rhodiola being over-harvested and threatened. I think it's endangered in Asia as well. Not sure what the situation is in North America. And we're starting to see growers here in France, in the French and the Swiss Alps. It needs to grow in the mountains. So in any case, I've been a lot more careful lately when recommending sources of rhodiola. But yes, it does provide very good support for cognitive functions and pairs very well with Bacopa. Holy basil and rosemary are very good too. Centella asiatica could be good. Not all of them together, but some carefully selected herbs. And in terms of supplements, I often suggest magnesium and omega-3s in the form of EPA and DHA. So overall, you could have a pretty good program for the tired student, whether he or she is young or old, and who's having a bit of a hard time preparing for exams. Brahmi can also be used in older individuals experiencing cognitive decline, ranging from mild memory and concentration issues to Alzheimer's disease in the early stages. And here, very often you will hear the expression age-related decline, which is problematic in my opinion. I don't think we should accept cognitive decline with age, otherwise everyone would be affected. You know, and we see 90-year-old folks who are pretty darn sharp, if you ask me. So I think we should say environmental, lifestyle, and societal related decline, right? Sorry, it's a mouthful, but that would be more accurate, although there is also a genetic component, to be sure. And of course, if decline happens, always check with a physician to see the best way to deal with the situation. Also keep in mind that with herbs, one of the risks would be to mask a symptom that a physician could use to make a proper diagnosis. And we don't want that, right? If there is cognitive decline in the aging person, the first thing is to do a medical checkup. And then once the diagnosis has been established, then you can think about herbs. In the context of Alzheimer's, Brahmi, which is the other name of Bacopa, I remind you, Brahmi is a valuable plant. Number one, for prevention, if there is a risk due to family history. At the early stages of the disease, to slow progression as much as possible. And in advanced stages, well, it depends. It might improve quality of life, even if it's just a little. You know, and there are cases where a little is still important, right? Although here you will probably have to think about possible interactions with medication. In Alzheimer's disease, the studies tell us that Bacopa may act in several interesting ways. Number one, it's a powerful brain antioxidant and anti-inflammatory. And the disease involves inflammation and high levels of oxidative stress, leading to tissue degeneration. And Bacopa may potentially block these processes. Then it promotes better cerebral circulation. It enhances brain plasticity, meaning the brain's ability to remodel and adapt, which is important for thinking and memory. It inhibits the formation of amyloid plaque, which is heavily involved in the deterioration of the brain structure in Alzheimer's. Bacopa therefore acts on multiple fronts, and once again we appreciate the remarkable potential of those medicinal plants. Nothing miraculous here, to be clear, but a pretty good solid long-term support. Now let's talk about attention deficit disorder, ADD or ADHD, when there is hyperactivity. It's one of the most common neurodevelopmental disorders that are diagnosed in children these days, manifesting itself in problems with inattention, hyperactivity, and impulsivity, which results in learning and social difficulties to integrate. We have a team that conducted the study in 2014 on 27 children with ADHD, and those kids took 225 milligrams of a Bacopa extract every day for 6 months, and the symptoms of ADHD were significantly reduced after this treatment, especially self-control, which increased in 89% of the children, and restlessness, which was reduced in 85% of those kids. And the researchers concluded by saying that those results clearly confirm that Bacopa has the potential for ADHD therapy. One last important property, Bacopa has anxiolytic and antidepressant properties. To my knowledge, the antidepressant effect was tested on animals only, with efficacy similar to imipramine, which is a common antidepressant drug. For anxiety, Bacopa was tested on animal models as well as humans. On animals, Bacopa was as effective as benzodiazepines without the side effects. And in humans, a dose of 150 milligrams of a standardized extract taken twice a day for 6 weeks resulted in a significant improvement in anxiety levels and mental fatigue. So if you suffer from low mood and anxiety, then don't think that St. John's wort is your only option, as magazines and books often suggest. Many plants can help, and they can be combined wisely. In terms of forms and quantities, so for the preparations, I will tell you what I use on a regular basis. And for the dosages, I will give you the recommendations of someone I have a lot of respect for. His name is David Winston, and I think we can use the term master herbalist when we talk about him. So, the tincture of the aerial parts, fresh or dried. If tinctured fresh, use 96% alcohol if you can. For the tincture of the dried plant, I have made a wonderful tincture with Bacopa powder that I brought from trustworthy sources using 50% alcohol. Winston recommends 1.5 to 2.5 milliliters of the tincture, or 30 to 50 drops, repeated 3 or 4 times per day. We have the tea of the dried aerial parts, which is quite strong tasting. Winston recommends 1 teaspoon of the dried herb for 8 ounces of hot water. You steep it for 40 minutes and you take 4 ounces 3 times per day. And well, I have simplified this for my practice. I say 1 teaspoon of the chopped dried herb per cup, and 2 cups a day, right? And again, the tea may end up quite strong tasting, so it needs to be drinkable. So adjust the quantities as you see fit. You can make the powder yourself from the dried herb using a coffee grinder and a small tea strainer to sift the powder. Then you can put it in capsules or mix it into applesauce, or just take it in a bit of water. In Ayurvedic medicine, the quantity of powder can range up to 5 to 10 grams per day, divided in 2 to 3 doses. I mean, this is a lot, right? It may be helpful in cases of significant cognitive decline, but it will be quite strong. So best to start with 2 to 3 grams per day. And finally, you can also find capsules of extract that are standardized in bacosides with concentrations ranging from 20 to 50% of bacosides. And the typical dosage here is 100 to 200 milligram twice a day, but also just look on the box what the lab says. In terms of precautions, not for use during pregnancy and breastfeeding. There are possible interactions with barbiturate medications. In animal studies, high doses increased thyroid activity and stimulated T4 production, which is a thyroid hormone. So caution is advised in cases of hyperthyroidism. So, and on the other hand, it might be indicated if you have hypothyroidism with mental fog. And finally, avoid in individuals with slower than average heart rate, what's called sinus bradycardia. And that is it for Bacopa, a little water plant that you can grow at home or in an aquarium or in the pond, and that can bring tremendous value to an aging population enduring cognitive decline. Thanks for being here. I will see you very soon for the next episode of The French Herbal.